Hi everyone. So today we are actually discussing about renal pathology. So this picture is suggestive of RPGN, that is rapid proliferative glomerulonephritis. So here you can see in the first picture, that is in the light microscopy, pass chaining, and the second one it is about electron microscopy. So what you can see in the first picture is about certain crescents. So that is crescents are the characteristic microscopic examination of RPGN. So the statement, I hope it is so clear. Crescents are the characteristic microscopic examination of RPGN. But remember that it is not the diagnostic microscopic examination, because it can be seen in RPGN, it can be seen in IgA nephropathy, it can be seen in PSGN, post-streptococcal glomerulonephritis. So that is why it is not a diagnostic microscopic examination, but it is a characteristic microscopic examination of RPGN. So that is question that can come by statements. Now let us see what is exactly responsible for this crescents. So once again here we will discuss that in detail. So this is the glomerular capillaries, endothelial cells, visceral epithelial cells. This is parietal epithelial cells and Bowman's capsule. So here inflammation has occurred because it may be because of an antibody, or it can be some infection like that. So inflammation has occurred and that will release cytokines. So the cytokines is released and they will actually damage this endothelium, they will damage basement membrane. So the basement membrane, there will be rupture of the basement membrane, and when there is any damage to the endothelium, what happens? They will initiate coagulation pathway. So there will be fibrin. So that fibrin will be released. So this, since the basement membrane is already ruptured, so this fibrin can even go outside. And one more thing, since here inflammation has occurred, mononuclear cells will infiltrate in this area, lymphocytes. So lymphocytes will also be here, the mononuclear cell infiltration. So there is rupture of the basement membrane, so this mononuclear cells and also this fibrin can reach here. So what happens is that they will cause this parietal cell to proliferate. So there will be proliferation of this parietal epithelial cells. So they will be proliferating like this. And we know that this proliferation of epithelial cells, actually they should fall into the urinary space. They should be removed via urine, but that is not happening because all these parietal cells, they will be stick together because of this fibrin. So fibrin is acting like glue. So as a whole, if you look at this picture, you can see this is almost forming a crescent. So that is the feature, again, crescent formation is a characteristic microscopic examination of RPGN. And it is important that this crescent you can see in light microscope with past staining, but the rupture of the basement membrane and also wrinkling can occur that can be seen in electron microscopy. So that is the picture which we have seen. First of all, the light microscopy we saw crescent. In the second one it is electron microscopy. Here you can see there is basement membrane has ruptured, and usually the basement membrane should be like this, but here it is almost wrinkling. So wrinkling and rupture can occur to the basement membrane that can be seen in electron microscopy. Now look at the crescents. In the crescents, what are the things you can see? So here you can I hope you can mark out some mononuclear cell infiltration, and the pink color, that is fibrin, and also you can see the parietal epithelial cells. So all this is forming crescent. That is parietal epithelial cell, fibrin, and also the mononuclear cells. Now what is the most important component of this crescent is always this fibrin. So we have said that fibrin is acting like glue. So all the cells proliferated is getting stick together and ultimately forming this crescent shape and everything. So this is about rapid proliferative glomerulonephritis. So once again just recall that the statement crescents are the characteristic microscopic examination of RPGN, and here rupture of basement membrane is there, and also you can see crescents in light microscopy, rupture in electron microscopy. That's all. Thank you.